The brain is a complex structure. It's essential that we continue understanding what drives diseases, what impacts brain function, how we can reverse it, and most importantly, prevent it from happening in the first place.
In our current society, we face stresses that are sometimes never ending. It's just stresses layered on top of stresses, layered on top of stresses. Stress leaves a very particular type of imprint on your brain.
In the next 20 years, there are international efforts directed towards trying to find better treatments for progressive MS. I do believe that there will be significant progress made in this sense.
Good evening, everybody. Welcome. Welcome to the, let me just sort out the microphone here, hold on. Welcome to this Global Perspectives panel. I'm Janet Rossand, and I'm President and Scientific Director of the Gairdner Foundation, hence the panel, the awards and the poster. The Gairdner Foundation is really one of the sponsors of this event. This is one of our Gairdner Global Perspective panels, Mindsets, a deep dive into the brain. And before we begin, I want to acknowledge that the land on which we are all operating tonight, known as Toronto, has for thousands of years been the traditional land of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and now is home to many diverse First Nations, Inuit, and Métis people from across Turtle Island. And we're very grateful to have the opportunity to work on this land. And we encourage all of you to learn more about the land on which you live, work, and play at nativeland.ca. I'd also like to thank our presenting sponsor, TELUS Health, for their generous support of our entire Global Perspective panel series. And for this particular one, obviously we have great partners in the Krembil Brain Institute and the Ontario Brain Institute for making this event happen. A little bit about the Gairdner Foundation, for those of you who don't know too much about it. The Gairdner Foundation celebrates and recognizes scientific excellence through the annual Canada Gairdner Awards. In the last 65 years, since the beginning of the foundation, we've given out 411 awards, and they've been presented to researchers from across the world whose research is having impact on human health. Those laureates come from 40 countries, and importantly, 98 of them have gone on to receive the Nobel Prize. 98, the last two, just this week on Monday, the Nobel Prize for Physiology and Medicine went to Drs. Carrico and Weissman for the messenger RNA vaccines against COVID. They received the Gairdner International Award last year. Yay, we're a good predictor yet again. But you know, celebrating excellence in science is very important, but we don't do it just to give prizes. We think that recognizing excellence really is important to enable us to engage with the public about the importance of science and to encourage the next generation to take up careers in research. So we have a lot of outreach events to inspire the next generation of researchers and to really facilitate open scientific discourse like we're having tonight to work better to educate the public about science, understanding the problems we face and working together to find solutions. That's why we're here today. In fact, one of the featured speakers tonight, Dr. Gairdner, is the recipient of our first ever Canada Gairdner Momentum Award. And the Momentum Award is a new award this year, which goes to mid-career Canadian scientists whose research is on the verge of reaching the level we want to see at the international and Nobel level. These are the next leaders, and Gairdner sits very well in that group. And she will join all the, this year's awardees during Canada Gairdner Science Week. That takes place in October, this month, 24th to the 26th. There are panels, symposia, networking opportunities, some all open to the public, and you can find the information on our website at gairdner.org. It all ends up with a great gala where we'll present the awards to all the awardees from this year. I encourage you to check out all the events and to register, and I hope to see all of you there. It's going to be fun. And now let me introduce the moderator for today's event, Mary Ito. And Mary Ito is a Canadian broadcast journalist who's worked in radio and television. I'm sure many of you have heard her voice on the radio as host of the CBC weekend morning show, Fresh Air, and still a familiar voice on the radio. She also works at TV Ontario, Global Television, and CFTO TV. She is currently the host of the CRAM. How do you do that? Cram? Cram. Oh, okay. I'm going to cram. The Cram podcast, which highlights the innovative work of Canadian scientists and big thinkers, really celebrating science and outreach, the kind of things that we think are important at Gairdner as well. So please join me in welcoming Mary to the stage.
Thank you very much, Janet. And thanks everyone for being here on such a beautiful day when you could be outside. We really appreciate your coming here. So how many of you have seen the movie The Wizard of Oz? Okay, I think just about everybody. That movie, I just loved it as a child. And I think that movie still rates as one of my all-time favorites. And when it comes to favorite characters in it, I don't know about you, but I loved the Scarecrow. Dorothy, a little precious, you know, I kind of thought. The Cowardly Lion, a bit over the top. The Tin Man, you know, all that tin, the hole in his nose, kind of half man, half tin box, a little creepy. Did anyone? I just found the Tin Man a little creepy as a child. But the Scarecrow, friendly guy, funny, right? And he just, you know, he got the job done. And what's interesting is the Scarecrow didn't have a brain, or at least he didn't think he had a brain until the wizard pointed out that he had a brain all along. And I think that many of us can relate to this. Sometimes we take our brains for granted, as the Scarecrow probably did, you know, when he was hanging out in the field, he's trying to scare those birds away, not living to his fullest potential. And we probably all feel like the Scarecrow that our brain is a mystery. It's remarkable in what it is capable of doing, but it is so complex in how it does it. And I think this is what will be impressed on you today. The brain's complexity, what can happen when things go wrong, and what our own, I was going to say doctors, but what our own wizards, I'm going to call them the brain wizards, are doing to find answers. And these wizards are neurologists, they're neurosurgeons, neuroscientists, and they're dedicated to finding solutions to some of the most difficult, the most perplexing, and the most important issues relating to the brain. And we have three at the top of their fields with us today. I'm sure you're going to have a lot of questions as well for our brain folks, and we are going to allow you the opportunity to ask those questions. Later on, we're going to put a slide up, and then it's just a matter of you texting questions. So we'll put that slide up a little later on, but I just wanted to prime you in case you think of a question. I'd like to introduce our first speaker, and just before I do, though, I was thinking about her work, and I would think that probably one of the most shocking things that someone can be told is that they have a brain tumor. Of course, there are many, many serious illnesses that we can face in life, but I think when it comes to something that is attacking our brain, you know, it's hitting something that is at the very core of our identity, right? Who we are. So when it comes to those doctors who work on the brain, the surgeons, we hold them in the very highest regard. And so much so that it's even entered our conversation, right? Because we often say, oh, well, that's not brain surgery, right? As if, you know, brain surgery is the standard by which we compare everything else to as being the most difficult. And it probably is one of the most difficult procedures. So when I think of our first speaker, Dr. Gairdner, I am in awe at what she has achieved and the challenges that she faces every day as a surgeon and also a researcher. She's co-director of the Krembil Brain Institute, Senior Scientist at Princess Margaret Cancer Research Institute, and Head of Neurosurgery at Toronto Western Hospital. She also holds the Wilkins Family Chair in Brain Tumor Research, focusing on building surgical clinical trials for brain tumor patients. She's a Dan Family Chair in the Division of Neurosurgery, and she is a professor of neurosurgery at the University of Toronto. And Dr. Zadeh is also one of the inaugural recipients of the 2023 Canada Gairdner Momentum Award. Please welcome Dr. Gairdner-Zadeh.
Thank you, Mary. It's a privilege really to be here tonight, and thank you, as Dr. Rawson said, for taking the time to be here. It is my honor to be one of the first recipients of the Gairdner Award. And really, I'm not sure how this happened to me, but I was very fortunate for the selection. I do think it's a bit of a pressure now put on me that everybody goes on to win the Nobel Prize. I could say that I'm not going to win the Nobel Prize, but I just saw a couple of my students in the audience. They know that I have the idea that's going to get me the Nobel Prize if they could just work on it hard enough to prove it. So, in thinking about how I would shape the discussion tonight, I thought I would actually just start out by telling you why I went into neurosurgery, because that's a question I get asked quite often. And I probably don't look like I fit the mold of a neurosurgeon, hence, why I showed up in a dress instead of my typical scrubs where I should have been in, because that's where I came from work. When I was in my first year of medical school, I was really amazed when I went into neuroanatomy. The structure of the brain was so fascinating to me, and the person explaining it to me made all of it come to life, and then also a lot of it made sense. And there was a lot of rationale as to why things were connected to each other and how that organ makes us who we are. So I was really fascinated by it, but I have to say I didn't quite know whether this was neurology or neurosurgery. I wasn't that ahead of the schedule of which field would allow me to interact with the brain as much. So I went and did a early elective in neurology, and through that I met the neurosurgeons on the ward, and they told me that I should go to neurosurgery with them and observe an operation, and so I did the next day. And I have to say I remember the day very clearly. The brain was open and I could see its structure, and it was and remains to me the most beautiful thing that you could see. Our organ that makes us who we are is really made delicately, and I think I have the privilege that I can see it every day and really have the opportunity through skill sets that I've learned through years be able to take care of pathologies that affect the brain and hopefully help an individual with what we can do. And the immediate effect that I saw the surgeon, who had a lot of focus, a lot of grace in his movements, and just a charismatic individual, be able to help that person with an immediate result was so rewarding to me that it attracted me to do neurosurgery. And I have to say, those are the same principles today that makes me want to go to work every day. We try our best to help preserve brain function and protect it for individuals that come across our path as neurosurgeons to take care of it. And again, I have to emphasize that with every operation we do, when you see the structures of the cranial nerves that allows us to see, that allows us to talk, as I do to you today, as it allows us to be who we are, it's an amazing structure. And so there must be some greater meaning to why we have our brain and how we're here to really help preserve and protect it. That said, I think we're still in its infancy of understanding how the brain works. And so that's also a big motivation. Why do I do research in the field of neurosciences, but in particular neuroscience and cancer? I wanted to learn the language of molecular biology, which I did during my PhD. And that allowed me a whole new world of being able to have investigative research, to have that inquiry as to how brain tumors develop, what we can do to stop them from growing, and how we can improve immediately, again, through what I would have done through skills with hands to do an operation, through knowledge to be able to improve patients' outcomes who have to deal with brain tumors. Another reason that I was attracted to neurosurgery is And I think this is true of all physicians, but in some ways, I would say for neurosurgery, as Mary mentioned, one of the worst things that probably people go through is unfortunately being given that they have a condition that infects their brain, because it is the most precious organ we have and it makes us who we are. And being a small part of the journey of helping them manage and come to terms with their diagnosis and go through that journey, I find really rewarding for me, actually. I like to get to know the individual, who they are. Again, the trainees who work with me know that I always ask what people do, who their families are, what the impact is to their life, because I want to be able to help them put things in perspective. And that's very rewarding to us as well, as physicians and as surgeons ultimately. And the goal of your surgery really is then tailored to that individual very specifically. Another reason to be attracted to neurosurgery is that it's one of the surgeries disciplines of surgery that uses extreme degree of innovation and technology. We rely heavily on advances in technology. So the technology that I use today is very different from what I used 10 years ago and what I used in my training. And when you look at the past few decades, we went from operating on this amazing precious organ with the naked eye, which can only really see so much, especially when you're at the depth of the brain, to a current state where we use high definition microscopes within 1 or 2 million range. Each of the microscopes allow us to see in high definition all the intricate structures that we need to be able to protect them and delicately be able to remove brain tumors and other pathologies from the brain. And so it's that innovation and technology that I think will be the future. And if you ask me where the future would be, I think the future is where we then use machine brain, machine spine interfaces, where we can then take computational strategies to apply them to the brain for regeneration and prevention of degeneration. We've been able to address majority of the degenerative processes of elsewhere in our body, but we haven't really done a good job, if any, for protecting the brain against degeneration. And I think machine-brain interfaces is what allows us to modulate the brain to be able to actually restore function and preserve function. So much like we do joint replacement, I think the machine-brain-spine interfaces is where the future will be. And we already do some of that neuromodulation. It's not an area that I focus on, but my colleagues do deep brain stimulation, where they identify critical structures in the brain that through electrical stimulation, you can in fact then restore some of the lost function of the brain or protect its function if it's been affected by degenerative conditions. Now on to my area specifically, which is brain tumors. It's always, as Mary mentioned, really anxiety provoking to the range of devastating when you hear the diagnosis of having a brain tumor. And our goal is to be able, through skills, through technical skills, operative skills, to remove tumors when they've intricately become involved in the brain. We can have a range of very benign brain tumors to aggressive malignant brain tumors. Aggressive malignant brain tumors have a prognosis of less than 1.5 years. So from the time of diagnosis to the time the patient passes away with that brain tumor is approximately 1.5 years. So the shortest longevity of any cancer that affects us in adult life. And this is a devastating statistic that hasn't changed in the last 20 years and more. We've had some few clinical trials that have showed mild benefit to the patient, but really the outcome for the patients continues to remain poor. And it's that really extreme poor prognosis that drives what we do in the lab to better understand what allows a brain tumor to become so aggressive that it evades all types of therapies. So if you compare the most aggressive brain cancer to other cancer types, breast, lung, prostate, melanoma, brain cancer has benefited very little from any progress that we've made, unfortunately. And so that's a huge motivator for us to be able to do better. And I think one of the areas we fall short is to be able to come up with a predictive test. So for breast cancer, mammogram has changed how we can screen the population for those that are at risk of developing breast cancer.
For prostate, we have a test with a PSA that, again, as a screening method, can identify those at risk. We don't have such equivalent for any type of brain cancer. And that's an area that we need to do better. And that's an area I think we've made an impact with our research. We're able to identify circulating pieces of DNA that come from a tumor that is shed in the bloodstream and use that to then be able to detect whether an individual has brain cancer or not. Of course, that's when we know the patient has brain cancer, we can use the blood test to demonstrate that in fact you can diagnose based on a blood test, not needing to take a tissue biopsy, not needing to open the brain and take a piece of the tumor, but really just using the blood test to detect that there is a cancer and what subtype of it in the brain. So then you can scale this up and say that perhaps you can use that very same test in a large population to convert it to a screening tool so that in the population, much like a mammogram, much like a PSA test, it will be able to tell us whether that individual has a higher risk of developing a brain cancer or not. And the reason that's valuable is that, of course, for all cancers, but importantly for brain cancer, if you intervene sooner, your outcome is better. By the time we see a patient who has already had symptoms from a brain tumor, it's already a little bit late because already the brain cancer has changed the brain structure. It's invaded the brain, and although we're able to remove majority of the tumor, there's significant portions of it that we cannot actually reach with surgery. And so we need to be able to detect and diagnose an aggressive cancerous growth in the brain earlier, and I think that's where we need to move at as a field. And that's an area of my research that I think has demonstrated that we're able to make that transformation happen. Another area I would say, going again with the theme of brain cancer, if you look at the last 2 decades, as I mentioned, the progress and outcome of patients has changed minimally. And that's because I think we continue to look at the disease in a very linear manner and continue to treat it with various chemotherapeutics. We really need to shift our paradigm. And I think how we can shift it is in our hands as surgeons by delivering therapeutics into the tumor directly, because as you know, there is a structure called the blood-brain barrier, which prevents drugs from reaching our brain. And so that prevention, in order to protect and preserve our brain, unfortunately, it becomes a challenge for us to get the chemotherapeutics to a therapeutic level, to a level sufficient to kill the cancer cells. And so to overcome that, I think as surgeons, we have a role to play to be able to deliver the therapeutics into the tumor. And most recently, again, I think an area that we have had significant impact is show through a clinical trial that by delivery of a virus into the tumor, we can actually prime the tumor to become more responsive to immune therapy and then kill and target the tumor cells with immune therapy and have an impact. And we demonstrated an almost 50% increase in median survival for patients with GBM, which is, as I mentioned, not something that we've seen in the field. Another big area of my research is focused on benign tumors. Benign tumors, in fact, are more common in the population than the aggressive brain cancer type that I mentioned to you. And it's very common amongst all people. So generally in a year, I would see approximately 3,000 patients. I only really need to operate, fortunately, on 300 of them. So not every brain tumor, in fact, needs an operation. Majority of them can be monitored with surveillance imaging. And I have to say, this is where I'm very proud of our Canadian healthcare system. We don't offer unnecessary surgeries. And so we tend to monitor patients if we can avoid an operation. But those benign tumors sometimes grow in areas that are very invasive, that wrap around critical brain structures, blood vessels, cranial nerves, other structures in our brain, that then makes our task of being able to remove it completely and cure the patient really impossible. So yesterday, for example, we did a 13-hour operation. The lady, thankfully, is doing very well, but the tumor is wrapped around the nerves to her eyes, both eyes, the blood vessels to her brain, both blood vessels, and also invades her normal critical brain. It's a completely benign tumor. However, the resection of it is lengthy, and we have to leave tumor behind because it involves critical structures. So then the question is, will that residual tumor that we had to leave behind to preserve her function continue to grow? And this is an area that we don't do very well, again, in my field, is the prediction of outcome for patients in general. It, of course, bears on how you manage your disease, but also it informs us on whether we have to treat the tumor early or not based on how fast it's going to come back. So we come up with predictive modeling in the lab. We use a lot of genomic information and bioinformatic computational analysis to be able to convert that data, all the information that we get from the many thousands of patients that we have, to be able to come up with formulas that can predict outcome for individual patients better than what we use currently in clinical practice. And again, I think that's what has shaped our research in large part in meningiomas, which are the benign brain tumors, and has had impact clinically. So in those three scenarios, hopefully I've given you a background of where I think our research is really transforming care for our patients. I've told you why I enjoy doing what I do on a daily basis, and I'll turn it to Mary for the next speakers. Thank you.
Thanks very much, Gallery. That was fascinating. I'm sure you found that as fascinating as I did, and we'll have more questions for her later on in the panel discussion. Now, here's a question for you. Who is not stressed? Who's never been stressed here? Like, not a moment. Anybody? Yeah, that's what I thought. Nobody. We're all stressed, right? We've been stressed. We feel stress. It just seems to be that this is sort of the human condition these days with our society. Well, our next researcher, I think that he's probably got the topic of the decade, or maybe the last few decades, because it's something that almost everybody, maybe everyone, thinks about, and that is stress and its effect on us, and more specifically, the effect on our brain. You're going to be amazed when you hear about the research that is going on in this area. Dr. Jaydeep Bains is the director of the Krembil Research Institute. He's also senior scientist at the Krembil Brain Institute, and his research focuses on understanding how the brain responds to stress and also how stress changes the brain. Now, he recently came from Calgary, and I know he's loving this weather, right, Jaydeep? So please give him a warm welcome. Dr. Jaydeep Bains.
Thanks, Mary. Hi, everyone. Mary took most of my intro, so I'm going to ad-lib on the fly here. I should have prepared notes. So I'll tell you a funny little personal Nobel story as we're talking about Nobels and Gairdners. So my daughter, who's now 18, when she was very young, she always wanted a dog. That's all she's ever wanted. And we said, no, we don't want a dog. I don't really like dogs. And she was 4. She heard in the morning on the radio that the Nobel Prizes had been announced. And she said, Mama and Papa, you're scientists. You could win a Nobel Prize, right? And we said, well, I guess my wife's a scientist. Yeah, I guess, yeah, we could win a Nobel Prize. And she said, if you win a Nobel Prize, can I get a dog? And we said, sure, yeah, you can. If we win a Nobel Prize, you can get a dog. We remain dogless. So now, when my nosy relatives say to me, how come you haven't won a Nobel Prize yet? I say, it's because I don't like dogs. Anyway, so we study stress. It is, as Mary indicated, the malady of our times. You can walk through any room, as Mary just did that very quick survey, and everyone has experienced stress. The first thing I'll tell you is that's completely normal. We should experience stress, because if we don't experience stress, our ability to survive decreases. So stress is this evolutionarily conserved response to challenges or threats in your environment. That same or very similar stress response is triggered when you have internal challenges, whether it's an infection or an immune challenge. That activates many of the same pathways in your brain, right, to respond quickly to that challenge. So in my lab, what we're really interested in is not just stress itself, but really how stress changes the brain. And our interest in this stems from the fact that stress, especially repeated stress or intense stress, can change the brain in a way that makes individuals more likely to exhibit behavioral traits that we're not always very comfortable talking about. Things like anxiety and depression. And so we think that if we can begin to understand how the brain is changed by stress, we can maybe gain some insights into these very debilitating conditions. The other thing that my lab is really interested in is trying to understand how managing or responding to one type of stress can change our ability to cope with other types of unrelated stress. And the final thing that we're really interested in, which is kind of a weird, little bit spooky thing for people, is the way that stress is transmitted to others. So we hear about this kind of in, general. If you do web search for stress contagion, for example, you get millions of hits. It's something people think about. We have sayings in society, stop it, you're stressing me out, right? Even though you may not be stressed. We intuitively understand that another person's stress can be our stress. But how does this happen? And so these are the kind of three broad areas that my lab focuses on. In terms of adapting and changing and how stress changes your brain, what we actually, I'll back up a second. All the experiments that we do are not on people because the type of detailed information that we need is not readily accessible. And so we use mice as a model to study the brain and to study how stress changes the brain. So one of the things that we've learned is that acute stresses leave a really lasting imprint on the brain. They change the way connections in the brain communicate with each other, right? So how cells in the brain communicate with each other through different connections. Sorry. That's just me showing bad posture. That's what it is. And so one of the things that we've learned is that the connections between cells in the brain, what we call synapses in the brain, are modified by stress. And these modifications persist for days. And these modifications result in changes in behavior, right? So that in the future, there's an increased sensitivity to stressors. And we're trying to unravel the molecular mechanisms through which that happens so that we can undo the effects of stress. The other thing that we try to understand is how engaging with a stress or responding to a stress makes us better able to cope or makes us more resilient in the future. So one of the things that the field at large and our lab has focused on is how does controlling the outcome of a stress change our brain? In other words, does knowing that you'll have a positive outcome to a stress, or does experiencing a stress and having a good outcome transfer so that in the future, when you experience a stress, you can manage it? And it turns out it does. It turns out that there's a very particular population of cells in the brain that sit deep in your brain in an area called the hypothalamus. And these cells integrate all the information from your brain about stress and then launch behaviors and hormones that help you manage your stress. It turns out that these cells learn when you challenge with a stress, and they learn particularly well when there's a positive outcome associated with the stress. And we can use this information to teach and then to alter future stress behaviors. And then the final thing is, how is stress transmitted and what does this mean? So stress does a whole bunch of things to our bodies. It engages brain pathways, it increases hormones, it changes our behavior. But it turns out that if a stressed individual interacts with another who is not stressed, the other individual shows the same set of characteristics, so shows very similar behaviors, shows the same changes in hormones, and shows the same changes in their neural circuits. So how does this happen? So it happens in mice through the transmission of a chemical signal that is detected through smell. And that signal mice release when they're stressed, and other mice pick it up. And it makes a lot of sense in the wild. You want to be able to alert others to threats, and you want to be able to do it very quietly. And so it provides an advantage for those who are around you to be able to detect that there's a threat nearby and adjust their behavior. So in us, of course, we detect stress in many ways. We're really visual creatures, so we detect stress based on the way somebody is sitting, their posture, when the way they walk. We're pretty good at picking these up. We detect stress when we listen and talk to people. But it turns out that we're actually pretty good at detecting stress through the odors that are released by others. We don't think about it very much, and we don't know very much about this. And one of the reasons we don't know very much about this is that a lot of the processing for these signals happens below the level of your cortex. So it happens below the level of your consciousness. And so this kind of stress cloud that we're all walking around in because of everyone else's stress, I think, and many other researchers think, that it's affecting our internal physiological state, our behavior, and it may be slowly changing our brain in ways that we don't fully understand. And the final thing I'll say about stress is one of the things that fascinates me about the study of stress is how difficult it is to try to untangle. Because if you're stressed, I can't actually tell. So your internal state, your internal stress state is invisible to everybody else unless you choose to reveal it, right? And this is one of the real challenges when we deal with stress and other issues that are related to emotion, to mental health, is that they're largely hidden from the person who needs to be able to detect them. And so, how we decipher this and the specific circuits in the brain that play a role in engaging these types of emotional states, to me, is just one of the biggest questions out there right now. And we're just so thrilled to be able to explore this. So, thank you.
Thanks very much, Jay Deep. So interesting, right? I feel as if, it's tapping into this kind of unspoken communication, right? That happens between people because, even when I think about walking into a room and someone is there, they don't necessarily have to say anything. Maybe you don't even see them, but you feel it. Like you feel that they're stressed. You feel that something's wrong. So, I mean, this is just a great area of research, and we'll hear more about it in our panel discussion. Well, I was thinking about what we need now at this time more than ever, and I think it's hope. It's what we need today, and it seems often that we're in short supply of it, given some of the huge problems we're facing in the world with climate change, political, social instability, war. So, what do we do? Well, there is one area of medicine, and we're going to talk about that now, where some major strides have been made that have not only offered hope to patients, but they have improved many lives. And you're going to hear about this from our next guest, Dr. Ji-Won Oh. She's a staff neurologist, scientist, and medical director of the Barlow Multiple Sclerosis Program at St. Michael's Hospital and the University of Toronto. She specializes in the care of people living with MS, which is very close to my heart because I used to be involved in the MS walks across Canada. I don't know if any of you have ever been on those, but I was involved for many years. She leads the MRI research program at St. Michael's Hospital and is also the principal investigator on numerous local and multi-center collaborative studies, including the Canadian Prospective Cohort Study to Understand Progression in MS. It's called CAN-PRO-CO. Please welcome Dr. Ji-Won Oh.
Thank you, Mary, for the kind introduction, and to the Gairdner Foundation for inviting me to be part of this amazing session tonight. I have to apologize. PowerPoint slides are kind of like my security blanket. So I am the person that had to show up with a few slides, but I promise that they're not too text heavy. I want to take the next 10 minutes to tell you a little bit about what has been happening in the field of MS or multiple sclerosis. And I know this is probably a very familiar disease to many of you because MS is the most common chronic neurological disease that affects young adults in Canada. And it's notable because MS is one of the few chronic neurological diseases that actually affects people in their 20s and 30s. And this is very different from many other common neurological diseases that we're familiar with, including diseases like, say, Alzheimer's and Parkinson's disease. And because it's a disease that affects young adults that are, at the prime of their lives, often starting families, often starting their professional lives, it's very, very visible. And Canada has one of the highest rates of MS in the world. It's known as an MS hotspot, and nearly 100,000 Canadians are affected. And so it's very common when you talk about MS that everybody knows somebody who has MS, particularly when you're living in a country like Canada. What's concerning is that the rate of MS is increasing, not just in Canada, but all around the world. And we still don't know exactly what causes MS, which prevents us from developing an effective cure. Again, because MS is one of the few chronic neurological diseases that affects young adults, as you can imagine, there can be substantial, both personal as well as professional and societal health repercussions. But the good news is MS, unlike many other chronic neurological diseases, has made incredible strides in the last 2 decades. And many other neurological diseases look at MS as somewhat of a success story because we're truly the only neurological disease state where there has been truly an explosion of different treatments that have become available only in the last 2 decades. So as you can see, this is a timeline that outlines all of the treatments that are currently available for MS. So things have changed dramatically in the last, it's been 10 to 15 years. And for me specifically, it's been a really interesting journey seeing how the MS field has evolved. Because I remember my first experience with MS was as a third-year medical student when I was trying to figure out what I wanted to do with my life. And I was here at St. Mike's at the MS clinic. And at that time, there were very, very few treatment options available, and MRI was rarely used to monitor people. It was used as a diagnostic tool, but not to monitor over time. Then when I started neurology residency, this was when the first infusion therapy, highly effective therapy, was approved for MS, and many people at the time thought it was the cure for MS, but it turned out to be not the case, but a very effective therapy at controlling relapses. And then I remember when I started fellowship, really every year or every 2 years, there's been a few new treatments that have become available. So for me in this career journey, it's been shocking to see us go from 3 different treatments to now nearly 30 different treatments for people living with MS. And so as a result of this, many things have changed. There's a real philosophy change in how we approach MS. We really emphasize early diagnosis, early treatment, rapid treatment optimization. We use obviously clinical tools, but also paraclinical tools like MRI to monitor people living with MS regularly. And then we're also recognizing the importance of multidisciplinary care to adequately care for people with MS. And this involves obviously not just the neurologist, but healthcare team members like OTs, PTs, psychiatrists, physiatrists, social workers, speech language pathologists, and the list goes on. So I think one of the most important things to move forward in a field is not just to celebrate the achievements, but to understand what the challenges are and what we currently recognize as limitations, because this is the only way that we'll be able to move forward. So I think I illustrated to you how much progress we've made in the field, and there's no denying that we should not celebrate these milestones that we've achieved in the MS field. But we still have a lot of issues. And And this is a list that summarizes some of the issues that we have. In Toronto, this is not the case, thanks to large, well-funded centers like ours. But in many parts of Ontario, even access to a neurologist who specializes in the care of people living with MS can be a challenge. Access to necessary multidisciplinary services. I just told you how important the entire healthcare team is in taking care of people with MS, but access to even PTs and OTs, rehab, psychiatrists, psychologists, it's very challenging, even at a well-funded center like ours. In addition, we're not really that good at personalizing treatment. I told you how we have now nearly 25 different treatments for MS, and I'll show you a few patient cases that really illustrate these points, but it's really difficult to tell from the very beginning who should be on one of the most highly effective therapies that has a bunch of side effects that can go with it, and who may be okay not being treated at all. In addition, one of the greatest unmet needs that we currently have is an effective treatment for progression in MS or progressive MS. And this is the type of MS where there's gradual progression over time to the point where people often require ambulatory aid even after having had disease for only 5 or 10 years. And we don't yet have any really effective treatments to help people with existing neurological damage. And this is truly the greatest unmet need in the field. So I think a case is always worth 1,000 words. Obviously, these are not real patient names, but these are stories of people that I treat living with MS. So let me give you an example. Amber is a 25-year-old woman who was just diagnosed with MS. She's told by her neurologist that she has 16 different treatment options. She's informed that there's emerging evidence that she should start treatment as soon as possible because in the MS field, much like the stroke field, we're now saying time is brain and spinal cord. So obviously this induces a lot of anxiety in her. She has a lot of questions. She wants to know whether she'll have relapses in the next few years, whether she'll develop neurological disability, and she wants to know which of these 16 medications is best for her. And I unfortunately can't really tell her what the answer to any of these questions is. So this is an illustration of the fact that we've made huge progress in the field, yet delivering personalized precision medicine to the individual patient in front of you is still a major challenge. This is the story of Tim. He's a 42-year-old male. He's noticed walking difficulties in the past 3 years, and he just kept shrugging it off, saying he's getting older. But now he can't get through a day without periodically resting, and he works as a manager at Home Depot, and colleagues have commented on this. He's avoided seeking medical care as his GP retired, and he hasn't been able to find a new GP. He is diagnosed eventually with primary progressive MS, and then he's told that there is only one treatment available, and that this treatment only decreases the rate of neurological disability worsening by about 24% over 2 years. So another illustration of one of the greatest unmet needs, we have nearly 25 treatments for relapsing MS, yet when it comes to the progressive type of MS, which is the type that is most debilitating, we have one treatment, and there's no denying that this is something that's very important and was also a milestone in the field, but this is a treatment that decreases your risk of neurological disease worsening by about 24%, maybe over 2 years. And that is progress, but as you can see, it is truly another unmet need in the field. Moving on, last case, this is Sophie. She's a 49-year-old woman who's had MS for 15 years. She's recently gotten divorced. She's had difficulties with her job as a building manager because of both physical and cognitive limitations related to her MS. She has significant depression. She clearly needs mental health support and PT and OT services, but through her job, she doesn't have any private health benefits to cover PT or OT or psychotherapy. She's referred to a psychiatrist by her MS specialist, but the wait list is more than 1 year. So as you can see, again, another great unmet need is access to all the multidisciplinary care team members that patients need to optimize their symptoms. So now that we know what the greatest limitations are, what are we doing to address these challenges? I don't want to dwell too much on these slides, but one of them is building large comprehensive centers like we have here at St. Michael's Hospital. We're very, very fortunate because two families, the Barfords and the Loves, both who have family members who are affected by MS, came together a number of years ago and put together this campaign where they raised $21 million and then the hospital raised another $21 million. And we've been able to build the largest MS center in Canada and probably the largest MS center in the world. And the mission is to provide patient-centered, comprehensive, personalized care in an inspiring environment by the very best integrated team applying and generating leading-edge research. And this was our opening ceremony that was very recent in the summer of 2021. And just really quickly, fun fact, I was 8 months pregnant, but you can't actually see because it was a very strategic covering of my belly. This is what our goals are at the Barlow MS Center on a foundation of excellence in clinical care because we are first and foremost clinicians. We also have two pillars of excellence that we're devoted to, including research and innovation and excellence in education. This is a slide of all of our MS specialists. We have 12 full-time MS neurologists, as well as 3 part-time neurologists, and the group keeps growing. We also have an outstanding multidisciplinary team. And again, I want to emphasize that we are so lucky to have this because the Barfords and the Loves came together to make it known how much MS care needs improvement at our hospital. But even around the province at large academic MS centers, this is most definitely not the case. And we still need more interdisciplinary members. We're also trying to develop novel clinical care pathways like in-person and virtual cognitive rehab and mindfulness and wellness programs to address some of these symptoms that I described in the patient cases. Internationally as well, there's a huge recognition that treatments for progressive MS are the greatest unmet need. And there are efforts internationally as well as nationally, including the CanProCo study, as you can see, where we are dedicating efforts and funding towards better understanding progression in MS, which is the only way we will eventually develop optimal treatments. This is just the Progressive MS Alliance, which is an international effort that raises a ton of money to fund studies directed at understanding progression in MS. There's also a lot of research happening here in Canada and around the world. There's international patient registries that include data from 80,000 patients, many different people doing advanced imaging research, fluid biomarker research, digital tools, and a number of international collaborations that are allowing for data in the scale that we have never seen before. And this is why things like AI are such important tools as well. So that's where we're at. We've made a huge amount of progress in MS, but it's very clear that much remains to be done. The things that I see changing in the next number of years, we need to advocate to the government to allocate appropriate funds to MS clinics across Canada. We need novel clinical programs to address unmet needs. We need more scientific discovery to develop better treatments and hopefully eventually develop a cure for MS. And I think we're also recognizing the importance of incorporating the patient voice in every aspect of care, research, as well as education. But overall, I think it's safe to say that the future is really bright. Thank you very much.
Thanks very much, G1. I loved your slides. I thought they were fabulous, right? They were fabulous. They were great. Thank you for using them. Okay, I'm going to call all the speakers up now because we're going to have we're going to have a quick little brain quiz, and then we're going to go right into a panel discussion. And I think, oh yes, so we put up the slide here just in case you have any questions, and perhaps they may be for a specific speaker. We've got the QR code there. And yes, and there is a link as well. And you can just send in your questions and we'll try to get to as many as possible. Oh, the clip. Oh, this one. Yeah, okay. All right, great. Now, what I thought we'd do just for fun, are your mics working? Do you want to just test them? Yeah? They're good? Okay. Okay, so what I thought it'd be kind of fun just kind of like an icebreaker sort of thing. We're going to have a quick brain quiz. I've got a couple of questions that each of our speakers is going to answer, and they have only about 10 seconds to answer each question. Okay. And I even, I had this old bell. I had it in my drawer, so I brought it. I thought, oh, this is so old fashioned and cool. All right. So, Galerie, Jiwan, and JD, are you ready? Okay. So let me start off. What are 3 adjectives that describe the brain for you? Galerie.
Precious, beautiful, intricate.
Oh, I like that. Okay, Jiwan.
Complex, deep, and intricate.
Okay, JD.
Perplexing, unknowable, complicated.
Yeah, I think. Oh, Galerie, what were you going to say?
I didn't know unknowable is magic.
It is now. It is now. Do you know what?
Taking marks away from me.
You know, what struck me though, what I loved about all 3 of you, because I interview so many scientists, as you know, through my podcast and through my work. For me, a true scientist is somebody who is as fascinated by what they discover as they are by what they don't know. And all 3 of you talked about that. You all talked about what you don't know and why it's important to pursue those areas. And I love that. I think that's so great that you look at it with such clear vision, about what you're doing and what the future holds. Anyway, okay, thank you for that. That gives us some sense of what you think of the brain. Next question. What is one superpower the brain has that amazes you? Galerie.
The superpower I would say that amazes me every time is that we can operate on someone's brain while they're awake. And we can stimulate to reproduce the function of the different areas of the brain, and they can communicate with us while they're awake. It's always really quite
That
fascinating.
isn't. Okay, I just got to ask you then, is that always true? Like, has no one ever put to sleep or even?
You have to be asleep, where you need to absolutely have precision and movement, so the head has to be fixed.
Okay.
But there's operations the patient would benefit from being awake,
Awake.
as it would allow us to map all the critical structures before we can enter to remove a tumor or remove a vascular pathology.
Wow.
And the person is awake, they're comfortable, and they can follow all of your commands of moving, speaking, responding, interacting. And it's a fascinating experience because you have a whole conversation with them, but you're also
Oh my goodness. Do they ever say ouch?
No, because once you're past the skull, there's actually no pain sensation.
Okay, that's good. All right. All right. Moving on. That was more than 10 seconds, but I asked you a couple of extras. So Jiwan, what's one superpower that the brain has that amazes you?
I would say it's resilience. I think it's amazing that when there is some sort of injury, the brain finds a way around it. And so, as a quick illustration, when people have strokes that affect a part of their brain that prevents them from speaking, they have aphasia. There are tools that you can use to say sing so that people can actually still speak if they're singing. So it's pretty incredible. And then can I tell you just one more fun fact about the brain? Did you know that the brain has such an amazing capacity that every person that you meet, their face is recorded on a part of your brain called the fusiform gyrus. And so every single person, every face that you see actually occupies a little bit of real estate in your brain. And that's incredible.
It is.
Capacity.
I just learned that fact this year, actually. Yeah, I was interviewing a researcher, and do you know that also has to do with our perception of beauty? Because what happens is all those different faces, they all become sort of a composite. And they become kind of like this averaging of faces. Yeah, that is a great fact. Great fact. Okay, JD, your turn. Super brain power.
I was here taking notes. This is fantastic. So super brain power. I think I'm always fascinated by the ability of the brain to simultaneously change and remain stable. It really puzzles me how this happens. You have one brain for your entire life, yet every single bit of that brain is swapped out and changed as you're living, right?
Yeah.
Because everything in your brain is living, so it has turnover. yet you complete your journey.
So true. Love it. Okay. In one short sentence, tell me why you're driven to learn more about the brain. Gallery.
I like the challenge.
Yeah. Okay. Do you want?
I think it's such a privilege to be able to study. Gallery said this a number of times, the organ that truly makes us who we are.
And JD?
Yeah, I think that, the brain is who we are, right? So the reason I want to continue studying the brain is I just think um, there are so many mysteries to unpack. And I think we have no understanding of how little we actually know about the brain. And the depth of that unknowable element really fascinates me.
Okay. That was our quick brain quiz. And now we're going to turn to some questions that have come from you, the audience. The first one actually is for you, JD. The question is, can you discuss the evidence that humans transmit and detect stress through smell?
Sure. There's a number of studies that have gone on to look at this. I'll tell you one of my favorites. Mary and I have discussed this in the past. And so there was a study done by a group of Israeli researchers looking at the ability of individuals to detect differences in smell that is generated in sweat from people who exercise versus people who go skydiving. And so that was their stress group. I think we could probably all agree. For most people, skydiving is more stressful than exercise. And so when they take sweat from these individuals and they put it on towels, and you ask people to smell, they can smell. People can smell the difference between these two scents, between somebody who's exercised and somebody who has gone skydiving. But then they did an experiment a number of experiments in which they piped the scent in through ventilation in a small room at a level that was not consciously perceptible to the subject. So they asked people, "Can you smell anything?" And they said no. And then they presented them with a number of cognitive tasks, some decision making, and they also had monitors on them to monitor heart rate, respiration, blood pressure, how sweaty their skin was. And they found that when they piped in the scent of the skydivers, people started to make more errors in judgment. They started to increase their respiration. Their skin started to get clammy. But this didn't happen when they piped in the smell of the sweat from people who exercised. So I think that's probably the best study that I've seen. It's a really clever design, and it's a fascinating set of data.
Yeah, I love that study. So my follow-up question to JD when he told me this was, okay, so then if we can detect stress through smell, what else could we detect, right? Is it possible that we could detect other emotions like joy?
Yeah, we don't know. Actually, we're trying to do experiments to figure this out. I think this would be amazing, but I think there's a very good reason why we and just about every animal organism can detect stress. It's beneficial to be able to detect threat signals that are generated by others, because then you don't have to experience the threat yourself if you can learn from that. And so I think evolutionarily, there's a reason why negative signals are detected more readily by our brain than positive signals.
Hmm. Have we determined whether we can detect sexual attraction through smell?
I think there's a really big body of literature, not necessarily around smell per se, but around pheromones that people have researched
Yeah.
extensively.
Okay. All right. Question for Jiwon. Why is Canada the capital of MS?
That is an excellent question, and one that we don't quite know the full answer to. But there are some inklings that we have, which include the fact that for a very long time, when you looked at a map of the world, there was clearly a higher prevalence of MS in places that were farther from the equator. And it wasn't clear what that factor was for quite some time. And there were all these questions about, is it an infectious agent? Is it some other environmental exposure? But it turns out, at least in part, that's probably explained by sunlight as well as serum vitamin D levels. So what we do know is that having a low vitamin D level does increase your risk of having MS substantially. But it's not the only story, just because everybody with a low vitamin D level does not develop MS. So like many complicated chronic neurological diseases, it's likely a combination of things. We do know that having a family member with MS does increase your risk, but it only increases your risk a bit to where if you have a first degree relative, it's about 2 to 4% of a risk. And so in the end, it probably is a combination of the perfect storm of having a genetic propensity mixed with maybe having low vitamin D as well as different environmental exposures. And related to what Jaydeep was saying, it's not uncommon that people present with a first relapse during a time of extreme stress. So it's clear that there are many different things that kind of come together to cause MS, but at least one of the reasons why there's such a high prevalence in Canada is related to vitamin D.
And why a significant number of women as opposed to men who get MS?
Again, we don't know the answer, and there's been a lot of research done looking at hormone levels because obviously there probably is some sort of role of estrogen and progesterone. There have been a bunch of clinical trials as well that have looked at hormone supplementation and different modulations of hormones, but we don't know exactly what it is yet. It does seem that there is some sort of difference in the female immune response that increases the risk of developing MS.
Here's a question for Gelleray. Actually, I had this question for you as well, Gelleray. What is the biggest challenge you face in making progress in brain tumor research?
What is the greatest challenge I face or the field faces?
Either one. You can answer either way. However you like.
I think one of the greatest challenges we face is that ultimately brain tumors are considered rare. So any one institution, if we compound all of our or combine all of our experiences, it still doesn't give us the large numbers that we need to better understand, to come up with that predictive modeling, the one test that will become the screen, etc. So the challenge is to work with multiple institutions and be able to bring everybody together to then build something that's a large data set to work with to understand the population of brain cancer. So I think one of the areas that we've been able to make impact is that we have been able to create a consortium that brings approximately 40 different institutions of comparable size together to then increase the numbers that we have to study. Because if I do it only at my institution, the results are not really going to be that impactful or that applicable to other institutions or other populations. I think that's one of the biggest challenges. The other reality is that again, by incidence, having brain cancer be smaller than other types of brain cancer by incidence, though the impact I would argue is greater because it takes away function from people. The amount of research dollars that we get is significantly lower than other cancer types. So carving out funding for brain cancer research becomes a big challenge. And the bigger ideas obviously require large scale funding. So I think that's one of the more practical reasons, in that in order for us to advance the field, to make innovation to happen, to make the avant-garde, to make the high risk happen, you need funding. And majority of the funding is diverted to, as you can imagine, there's rationale to it, but unfortunately a lot of it is not directed towards brain cancer research. So I think that's one of the greatest, actually, the limitations in our system in general.
One thing I was wondering too, is there actually something sort of physiologically or structurally different with a tumor in the brain as opposed to, let's say, a tumor anywhere else in the body?
Again, I would go back to the brain is really a precious organ, and almost every single piece of it has a function. So the biggest challenge is that we cannot risk losing any part of the brain in order to then remove a tumor or remove part of a tumor, etc. I think that's one of the biggest limitations for us. Of course, all of our organs are essential and important, but if you had, God forbid, colon cancer, you could lose a lot of your colon and still function. There is also mechanisms to replace that lost colon. However, you cannot lose any part of your brain and still function. So I think that's a reality. A majority of all of our areas of our brain, there are silent corridors that we know of that we access different brain structures, and as a consequence, the tumors that affect them. But majority of our brain is very high functioning, and so we have to be able to identify eloquence and then access the tumor and remove it without leaving as much impact for the person.
Okay, great. Thank you. Jiwan, MS is an autoimmune disease. Would discovering some kind of fundamental answer about how MS behaves help with answers to other autoimmune diseases that might be similar, like lupus, arthritis?
Yes, I think there's a lot of overlap, but obvious differences between many of these inflammatory diseases. But it's not uncommon that we have treatments that are effective for MS as well as, say, rheumatoid arthritis and lupus. And even with this major new generation of treatments that are currently being tested in MS clinical trials, which are these molecules known as Bruton's tyrosine kinase inhibitors, it's really interesting because the older generation of BTKIs were used in the rheumatologic literature quite a bit. And so there's a lot of lessons to be learned, from the MS field, from other autoimmune diseases, but vice versa. I think we also have lessons that we can teach other autoimmune diseases.
Okay, and here's a question for JD. Are there genetic markers for people who seem to be stress free? Who are these people? I'd like to know who put that question in. Who are these people who are stress free?
Yeah, I wish. Yeah, I don't think I've ever come across anything in terms of genetic markers for people who exhibit resilience. People have, adopted a lot of behavioral strategies that facilitate resilience, but in terms of genetic markers, I don't know of anything out there.
And here's another question for you, JD. I was saying earlier, well, yeah, we all seem stressed out, right? Everybody raised their hands about being stressed. But how much do you think is in our control that we can alleviate that stress? So, for example, I think, let's say I'm stressed, but then I go take a holiday and I feel great. I feel rejuvenated and I come back and I feel, less stressed. But all I did was I just took that holiday. So, is there some way that we can actually have a holiday in our brain when we need it? You know what I mean?
Yep, yep, yeah. So I think there's a very active part of the field trying to understand how you can not just buffer, but maybe erase some of the consequences of stress, or erase some of the imprints that stress leaves on your brain. So two that I'll tell you about. When I tell you, you'll go, well, of course. One is exercise, and the other is some type of hedonic stimulus, chocolate, ice cream, the things that you always reach for when you're stressed naturally. So we've been really curious about this in the lab recently to ask, like, is this just a short-term thing, or is this actually preventing stress from laying its marks on the kind of, synapses, connections between cells and different molecules in the brain? And it's turning out to be the latter. So we're really just digging into this right now.
Thank you. And Jiwan, are there reasons why the rates of MS are rising globally?
So, in part, it is related to the fact that we have much more readily available access to MRIs, which is now becoming an essential diagnostic tool. But it's not the whole story. And even in, say, parts of the world like East Asia, the Middle East, where traditionally MS has not been a highly prevalent disease, the incidence is rising all over the world. So there's a lot of theories as to why this is happening. Could it be due to our excessive use of sunscreen? I'm just kidding about that. But maybe there's some sort of dietary change Is the adoption of, say, more traditionally Western diets in different parts of the world changing, this perfect storm of events that needs to happen to make this happen? There's a lot more immigration, emigration, and we do know that there are certain areas of the world where if you do move as a child, even if you're from a low prevalence area, you tend to acquire the risk of the area that you live in up to the age of 15. So lots of unknown questions. We don't know what it is. You've probably heard recently about the definitive study that showed that EBV is a necessary but insufficient factor to cause MS. So that is also part of the puzzle. But the bottom line is we don't know. It's very complicated, and that's kind of the million-dollar question.
Thank you. Gairdner, when someone gets a prognosis that they only have a year to live, what becomes important to them?
Obviously, it's different for every person. I think realistically, based on my experience and what I tell people, is that it really takes a good 3 months to have the information sink in, the knowledge that your longevity is limited. I mean, for all of us, we can't know what our longevity is. However, we all don't necessarily think about it. But when a person has that diagnosis, they now know for certain that their longevity is limited. It does take a good 3 months for the individual, whether they're young, don't have dependents, they're older, midlife, etc. It's very variable from person to person. But ultimately, I think it's the recognition of what life is and then a conversion to getting to a place where you hopefully can appreciate every day for what it is and then live one day at a time, because that is really all you have for the rest of the year that was given to you. But I think every person is very different. There's a major component of denial. We all go through it, and I think everybody's experienced it in their life in different manner. But when it's such a dramatic diagnosis and such a dramatic prognosis where you really know that there is an almost 100% recurrence rate for this cancer, it's a massive impact on how you view yourself, your life, and the reactions are quite variable. But I think inevitably the reactions are quite strong, regardless of which category the person falls into. And so I think, as I mentioned earlier, to me, I see it really not so much that I can impact necessarily with surgery the outcome of the person, but how I can help them through that process of recognition so they can actually get to a place where they can enjoy day to day and not think so much of the future. It's human nature to want to know what's going to happen. Where am I going to be in a year, 2 years, etc. It's rare that you actually naturally just take a day at a time, unless you recognize that this is what life is actually about.
Can I ask, how has that impacted you and the way you see your
I
life?
really do live in the moment. I do live a day at a time because I don't know what the future is going to bring. And um, it's not so much because of what I do. I think it's just my life experiences. I do really live, I try to, as much as possible, to live in the moment, which is why I don't really get super stressed out, because that stress factor, whatever is stressing you out, will ultimately disappear. It's not going to be there forever. So if we have a really rough day, it's busy, it's stressful, I always say, well, this day will end and tomorrow is just another new day. So the stress will be gone.
JD, sign her up,
Yeah.
right? Yeah, I think you need to. Actually, can I put that question to both of you, G1 and JD, about your work and the impact it's had on your life, how it might have changed your life?
Well, I should give you a little bit of background. I think part of the reason I was drawn to the field of MS as a neurology resident, I went into neurology because my mom actually had an autoimmune disease that affected her vessels, and she had a stroke when she was 35, and so it left her suddenly changed with right-sided weakness, difficulty speaking. And I mean, it had a profound effect on my childhood, and I realized how everything can change in a day. And she's doing really well and stable, but it really changed our family dynamic, and probably over time for the better. But going into neurology, I thought I wanted to be a stroke neurologist. But then when I started spending more time in the MS clinic, I realized this really hit close to home because I remember going to all of these medical appointments with her and the difference that a truly caring clinician can make to improve these little things that she has that she's struggling with. And so that was what drew me to the field of MS. And I think I live with that every day, knowing that again, I also tend to live in the moment because I know that everything can change in a minute, and just to be present and to appreciate what you have and to take joy in the little things. That's probably what I take home with me.
Thank you. JD, what about your work and how it's impacted you?
Yeah, yeah. So I'm a basic researcher. I don't see patients very often, so that kind of emotional impact is really quite different for me. Um, I think one of the things I've realized as I've stayed in science for a couple of decades is how not how the work impacts me, but how being involved in the work can impact others, and in particular, young students and postdoctoral fellows, and using science and the complex questions that you pose when you're exploring the brain, how they teach you to think in a very different, unique way, so that in life later, when you do face problems, you can use the way that you think about scientific problems to approach life problems, and that can be actually really, really helpful.
I'm so glad you brought that up because we actually have that as a question. We just have a few minutes left. So if I could just go around to each of you and maybe you could give a quick answer to this question. Do you have any advice for undergraduates to get where you are today? Gallery?
I think the trick is to find something that you're really passionate about because the all the other factors fall into place. It's not always easy to find what you're passionate about, and it's important to keep in mind that the path is never linear. And so you may come upon what you want to do just by coincidence, and you may have not even thought about it. But I think you have to be open to opportunities and open to new ideas, new directions, and ultimately what you're passionate about will emerge, and then that will lead you to being able to be successful and be happy in what you're doing, because everything else will fall into place.
Yeah, weren't you going to be an accountant?
An accountant?
Yeah.
No, that was my necessity. I needed a job.
Oh,
Okay. I wanted to be an architect.
oh, an architect.
I still think I might be.
you still could be. Jiwan, any advice for undergrads?
I think Gallery said it really well. Find something that you're passionate about and work really hard and do the very best that you can. And seize opportunities when they become available and take chances.
JD.
Yeah, I think I was one of those dispassionate students. I couldn't find the thing that I liked, so I just tried science because somebody gave me an opportunity, and so one of the things that I loved, one of the things I realized, and this is going to sound a little bit strange, um, about a year and a half into it, what I realized was, oh, this is actually not very hard. But what I realized when I made that kind of observation was that it wasn't hard for me. It's not that it wasn't intrinsically hard. It may have been very hard for somebody else, but for me, it was not that hard. And so, what I took away from that is, oh, this is clicking for me on many levels. And I don't fully understand that, but I'm just going to go with it. And so, my career has really been one of just following a path of least resistance because I feel like that's the path that I am able to process and go down in a kind of very accessible and open way. That's the path that I should take.
Love what you do.
Yep.
Yeah. Thank you. I'm going to use my bell. That concludes our panel discussion. Thank you. What a wonderful panel. Thank you for all your questions. I didn't even get to them all, but thank you for contributing them. That is pretty much it for our event tonight. My deepest thanks to Gairdner, G1O, J.D. Baines. Please give them a big round of applause. Just want to mention as well that this event is part of the Global Perspective Panel Series. It's sponsored by TELUS Health. Thank you to TELUS Health. Thank also to our event hosts, Gairdner Foundation, Krembil Brain Institute, and the Ontario Brain Institute. Now, to learn more about Doctors Zadeh and Baines' research, you can listen to Your Complex Brain podcast. I've listened to it. It's excellent, and you can get it wherever you get your podcasts. You can also join the Ontario Brain Institute on November the 29th. That is the next installment of our Brain Health Basics Public Talk series. Great topic, sleep and relax for brain health. You can learn what OBI and partners from the University of Ottawa, the Centre for Addiction and Mental Health, and ROGA have discovered about sleep and the brain and how practicing mindfulness can support relaxation and rest. Sounds terrific. Now, registration is open as well for Gairdner Science Week. It takes place from October the 23rd to the 27th. Gairdner Science Week is an annual celebration of the Gairdner Awards laureates and scientific excellence. So again, great speakers there. You can join us for a week of panels, symposia, networking opportunities, free, open to the public. Register for events at gairdner.org. You can scan the QR code as well that's on the screen. And finally, we'd love to hear about your experience here. So if you can fill out the Gairdner survey, scanning again the QR code, or you can also head to the link on the screen. Thank you again to all of you for showing up tonight. Have a good night and a safe journey home. Thank you.